Myself, Rakhi Nandan, nursing lecturer at MGM College of Nursing and Paramedical. Today, I am going to show the procedure active management of third stage of labor. So, for the procedure, we need some articles. First, we need gloves, sterile gloves, to prevent the infection, to prevent the cross infection. Next, we need artery forceps to clamp the cord. Then we need 10 units of oxytocin. And if we do not have oxytocin, we may use misoprostol 600 mcg. We will use 3 tablets, 1 tablet of 200 mcg. So oxytocin and misoprostols are uterotonic drugs which use or help to contract the uterus and prevents postpartum hemorrhage. So yeah, it stops the bleeding. Okay. So how we will know that the placenta has been separated from the uterus? There are 4 signs through which we can see that the placenta has been separated from the uterine margin. First, it will palpate the fundus or uterus. We will see the uterus will become hard and globular. Okay. Next, there will be the lengthening of cord. Third, the blood will ooze out and the outer orifices, vaginal orifices will look bulge out. Okay.
So these are the signs of placental separation from the uterine margin.
And before this, I want to tell you that
we will put our one hand on the fundus and palpate and check that if in case of twin pregnancy another baby is present or not, and if our dominant hand we will see the vaginal orifices that the another baby is there or not. We'll insert our 2 finger, then inspect that another baby is there or not.
We have 3 main procedures which we do in active management of third stage of labor. First one is uterine massage. Second one is we give 10 international unit of oxytocin IM
within 1 minute of delivery of baby.
Okay, where we give at the lateral, anterior-lateral aspect of the thigh. How we will know? Okay, we'll take one hand, put at the thigh, up above the thigh. Okay, then we'll put another hand above the knee, and the area between it we can give. These are the vastus lateralis muscles, and we can give IM injection here. Okay, and in case of emergency only, like if we are in the community sources or there is a lack of resources, then only we will give misoprostol because it has some side effects like shivering, fever, nausea. That's why we don't give misoprostol on regular basis. Only in emergency, if oxytocin is not available, then only we give misoprostol. So first, how we will start the procedure? First, we'll roll the cord and hold it. We'll put one of our hand at the uterus above the symphysis pubis and push the uterus upward so that the uterus will not prolapse or there will not be the retrobirth uterus case. And now we will apply control cord traction method, which will pull the cord forward with the downward forward.
We need to do the procedure in the same manner unless the placenta is coming out. Downward, forward, downward, forward, downward, forward. And if the placenta is not coming out, we will wait for 5 minutes, and when the contraction will come, then we'll start with the control cord traction method. Normally or commonly, it takes 10 to 15 minutes for the delivery of placenta after the delivery of baby.
Once the placenta is visible, comes at the vaginal orifices, okay, it will reach and it is visible, we will remove our dominant hand and we will hold the placenta with both hands and twist the placenta clockwise and keep it in the kidneys. Okay. So after taking the placenta, we will check for the presence of cotyledons. 16 to 20 cotyledons are present or not, and we'll hold the placenta this manner, and in the membrane should be lying down in the form of umbrella. Okay. We will keep in the 1 kidney basin, or we can take a tray and we will keep it in it. So now what we need to do, we need to massage the uterus. We will make our palm cup shape, keep our hand over the fundus, we'll give abdominal massage, or you can see uterine massage or fundal massage with another hand. We'll apply little force and push it, and the remaining clots and blood will come out. We should note that how much amount of blood is coming out, and then we'll inspect the vaginal orifices, okay, and see if there any tear, rupture, bleeding or clot or present is not. If there is tear, rupture or episiotomy, we'll call the doctor for suturing. Okay.
Then we'll give uterine, fundal or abdominal massage. We'll make our palm cup shape, then put it on the fundus and massage it in circular manner. And if the uterus become hard or gobbler like a cricket ball, then we'll leave. And if it is still the soft, then we'll continue for 30 to 40 seconds till it become hard.
And after that, we'll wash the area with lukewarm water. Then we'll do perineal care with antiseptic solution. We'll apply the pad and we'll keep the patient in comfortable position. Nowadays, we do not insert our whole hand into the uterus because there is complications like, first of all, there is a chances of cross infection. Okay, we'll spread the infection by our hand. Okay. Second, when we insert our hand, we are giving the pressure or massage from outside. It is enough. It is enough for vaginal contraction or letting the product of conception to come out. Okay, it's enough. We don't need to insert our hand and provide pressure, apply pressure to the uterus. It will hinder the natural process of contraction. It will also lead to the postpartum hemorrhage, and there may be a chances of damage of uterus. So that's why we do not nowadays we do not practice of inserting our hands and cleaning the uterus or inspecting. Okay, we do not inspect in this way. So this was the procedure of third stage management of labor. Thank you. And one more thing I want to tell, before cutting the cord from the baby, we should always
will apply first clamp at the distance of 3 cm from the umbilical and the second clamp at the distance of 5 cm from the umbilicals in normal case. In cases like RH incompatibility, will apply at 4 cm, and we will apply the clamp only when the pulsation of the cord will stop. Before that we will not apply. And between the two clamps, like we had applied first clamp and second clamp, we will cut the cord from between it, and then we can continue with the procedures like control contraction method or active management of third stage of labor. So this was my procedure. Thank you for watching it. Please subscribe to my channel, share and like my channel. Thank you.